So in evidence-based medicine, it's important to remember that we're trying to answer questions about the causal relationship between exposures and diseases. So there are many studies that just look at associations, and those can be important for many things, including public health. But to inform clinical decisions, we really need to understand causal relationships. And so, as we've been discussing so far, we're asking, does this particular exposure cause this disease? And remember that this is a very abstract language, so this also applies to treatment. So we're really looking more broadly at causal relationships. So we could be also asking, does this treatment cure this disease? So, in this case, the exposure is considered a treatment, and the exposure in this case would be protective for the disease, or would cure it. So in order for a treatment to cure the disease, there has to be some causal relationship between them. So ultimately, we are interested in answering questions about causality. So in this video, we're going to briefly talk about how we know when an association is causal. So here we have our evidence hierarchy again from evidence-based medicine, and as we said before, the bottom of the hierarchy, these types of study designs can provide evidence for an association between an exposure and a disease. But we call this a mere association because what that points out is that it's not a causal relationship. And as we move towards the top of the hierarchy, as we discussed before, we have greater evidence for causality. And so this is a continuum. So when we move into these analytic studies are different from the descriptive in the sense that they do provide evidence for causality. But the cohort and case control, the two observational analytic studies, provide some evidence for causality. It's better than the studies designs below it, okay? But it's not as good as the randomized controlled trial. And so we're going to talk about why that is. So how do we answer the question about what causes disease X? So let's create a scenario here. It'll be somewhat artificial just to make the point, but let's say we have Marla, and she's a patient, and Marla has disease X, and she also has a number of potential causes of disease X, which we're calling A, B, C, and D. And the reason we know these are potential causes is because we have seen these factors associated with disease X in the past. So patients who have these tend to have disease X or vice versa. So, but we're not sure which of these are causes. So how do we answer that question? Okay, so now we're in the ideal world that doesn't exist, but it's here to make our point. And so we're asking what causes disease X, and we have 4 different potential exposures that we're interested in exploring. So the first thing we want to remember is that whenever we're doing a study, we have a very specific hypothesis in mind. So when we're looking at, when we're asking the question of which of these exposures causes disease X, we need to ask one at a time. So the first question we're going to ask is, does A cause disease X? So the first thing we're going to do is, and this is where the ideal part comes in, we're going to create 2 patients, and let's just say we're continuing with Marla. So we have 2 Marlas. They're exactly the same in every respect. The only difference is that one is exposed to potential cause A and one is not exposed to potential cause A. Okay, so the ideal scenario here is that these 2 groups, let's say, because of course we're going to have more than one person, but this Marla represents our group as a whole. These groups are exactly the same, except that one has the exposure and one does not have the exposure. And then we look at the likelihood of having the disease in each of these groups. So if the group that's exposed to A, that has A, is more likely to get the disease. So if the disease is more common in this group than it is in this group, when Marla does not have A and the rest of the group does not have A, if the disease is higher here than it is here, that suggests that there's a causal relationship between A and the disease, between this exposure and this disease. Okay, so we said what's really important here, and this is in our ideal world. In our ideal world, we can make sure that everything is exactly the same in these two groups except for the exposure that we're interested in. So in our little experiment here, we showed that Marla has the exposed group has A, and the non-exposed group does not have A, but otherwise they're exactly the same. So in reality, of course, this is extremely difficult to control. And so let's just say that we're not now in the ideal world, and that now our exposed group has two other things in common that are not true of the non-exposed group. Okay, so now our exposed group has A, B, C, D, but it also has E and F. Okay, so otherwise everything's the same. Here, it doesn't have A, but it has B, C, D, but now it doesn't have E or F. And so now, say we get the same outcome. We get disease X higher in this exposed group than the not exposed. But if E and F are also here, different between this exposed group and the comparison group, we don't know whether the disease is caused by A or by E and F, E or F, or by all three. So these two are called confounding factors. And they are things that differ between the exposed group and the comparison group or the not exposed group that you are not sure, but they may be related to the outcome. So we'll talk more about confounding factors later, but the point here is that in a study design, the comparison group is constructed differently in the different kinds of study designs. And so the extent to which these two groups, exposed and not exposed, are similar, aside from the exposure of interest, creates the greater support for a causal inference from the study. So the randomized controlled trial, why that's so good is because it is the best method of controlling for variables between the exposed and the unexposed group. And the case control study, you have to create your comparison group, and it creates a lot of problems in the fact that you have to create your group yourself. So anyway, we will discuss this more later, but what's important to know here is, and to understand, is why the comparison group is so important and what it has to do with inferring causality.